My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by Warren Templeton. Warren, welcome to the show.
Thanks, Norm. Thanks for having me.
Absolutely. I just spilled a little water on myself. So in today's episode, we're thrilled to have Warren. Warren is a managing director at Health2047, and joining us, and he's got a background that spans from co-founding a market content creation platform to shaping growth strategies at Fitbit. Warren also brings a unique perspective to the intersection of health tech, product development, and consumer engagement. Currently sitting on the board of RecoverX, which is a Health2047 portfolio company. Warren's wealth of experience includes building, trading technology for major financial institutions, and we can't wait to learn about your whole career. So, Warren, welcome, and walk us through your experience being an employee at Fitbit during its monumental IPO.
That was a really fascinating time. So it was my first and only IPO. I hope there's another one to come. But it was this kind of moment that I think we were all shocked, right? Here was this relatively known commercial product, but now they had like billions of dollars in revenue, et cetera. And so what the IPO did was it created this amazing deal flow. So if you go back to 2015, which is when the IPO happened, right? Health tech was still in its early days. iRhythm was still putting out content that said, "Hey, trust us, we can be your new Holter monitor." And I think the Fitbit IPO really exposed the world of attractiveness between the connected, step counters and things like that, and the quantified self. So, James Park and Eric Friedman did an outstanding job at kind of building the company. So I had joined doing M&A with the team. We had done, we were completing an acquisition of Fitstar, which was this first opportunity to build a for-fee, for-payment service model alongside the hardware products. And it really kind of opened, I think, most of the team's eyes. Not only, the NASDAQ investors are really excited about it, but for us, it was, okay, what's the extra levels of that stickiness? And so, Apple were the only ones at the time who really had cracked the hardware plus software code, and here was this really nimble small company that was already starting to think about that. So I was over the moon doing that. We did over, I think, 200 transactions in about 200 diligence calls in about 3 or 4 months, which was definitely a tiring time. But we were exposed to all of these amazing new, whether it was services, the transition to healthcare, and then the sensors themselves. And so that was my exposure. And then I think the other fun one was working with people like Amy McDonough, who she was the SVP in charge of their commercial business, which was really this opportunity to sell those devices to payers, to their members, and say, hey, if you can do this quantified self, there's a benefit to your members. And it went from being a benefit to a health add-on to those plans. And so that's actually how I got my introduction into healthcare.
That's fantastic. Talk us through what you did before.
So I started my career in investment banking. I was a computer science and business undergrad. For all the benefits that it was, I was living in the UK doing my undergrad and went to go work in London. I worked at Deutsche Bank, JP Morgan, and last at Morgan Stanley. Built trading systems, did everything from accounting platforms to mainframe rewrites to the last one, which was this early, actually, machine learning tool set that was optimizing asset placement. And it was this kind of moment of, hey, this is amazing what computers can do with with minimal information and sorting. Like, what else can we do with it? And so that was how I spent the first, I guess it was 10 years doing that. And I kind of had this moment of inflection. Should I go do my MBA or not? And it just felt like the right time in 2014.
Fantastic. What inspired you to join Health 24/7?
So going back to the time at Fitbit, I had all this like aha moment at the kind of end of my time there, where it was this convergence of consumer tech and healthcare, and there was nobody else that was really kind of there to pick up the pieces from the backside of where we could take this quantified self, right? And so we can read all about now even to this day how hard it is to take real world evidence and put that into clinical workflow that makes sense. And so, the aha moment was, hey, there's got to be a way of doing this that doesn't mean that only consumer tech companies can do it, and there's got to be opportunity to do this, to build innovative solutions in that space. And so I actually went to go speak to a couple of VCs here in the Valley. Really thoughtful advice, but the main thing they said was go find somebody who's trying to do this, who've got a corporate innovation partner, because what you're really looking for is that. And I happened to run into Dr. Doug Given, our founder, and he was over the moon and thrilled to talk about what they were doing with Health2047, which was founded in 2016. And he said, look, we're building businesses, and we need people who understand business and product, and that was my intro into what we're doing at Health2047.
Yeah, talk to me about what Health2047 is doing that's unique, and just more information about the organization for those who don't know.
Sure. So Health2047 is the venture studio backed by the American Medical Association. We partner chiefly with founders to build their concept from generally an idea all the way through to getting their seed funding. And so we'll partner with those founders on a variety of different things. It's tailored to their needs, their business, their opportunity, and kind of help them work through whether that's business model and commercial strategy, which is where I spend most of my time, all the way through to the technical expertise required or regulatory considerations, et cetera, that get us to get that business to be ready to go kind of prime time to go talk to institutional seed investors.
And how long has the business been around prior to you joining?
So I guess I probably joined about 6 months after the company was actually founded. I think there was a big excitement around JPM, and I joined in July of that year. We've actually had kind of two major iterations. The first was, we had to figure out how to build businesses, and so that was where I came on, which was we're going to build some businesses. And as that part of that process, we learned a couple of things, right? Number one, it's really bloody hard to do in healthcare. But number two is, what are the things that we were finding we needed help with? Well, if we, with plenty of resources, we're finding these things hard, then this has to be the same problem that others are having. And so that's when we really made this decision to transition to doing a lot more thoughtful engagement with outside founders.
That's great. Where are you sourcing, these opportunities and these companies? Where are you getting your deal flow from?
Great question. So I think of it in kind of like three groupings. So the first one is networking, right? So yes, friends, but more importantly, showing up to places like HLTH, which we just had a couple weeks ago, Vive, frankly, other incubators in whether it's Bay Area or nationally, to talk to them about what we're trying to do, giving them the kind of pitch we just gave, and finding innovators in that sense. The next is we work with a number of academic medical centers, research institutions, et cetera, really to kind of bolster their innovation pipeline. Like how do you help a scientist figure out that this could be a business opportunity, and then hoping that the goal is that on the backside when they do get to the aha moment that we're a helpful place for that to land. And then the final piece is, and we're going to be doing a little bit more, I think, next year, which is how do we kind of approach this from where the innovators are hanging out, right? So, online, pathways and patterns, as well as looking for other ways to get founders from underserved communities into our pipeline. It's a blind spot, and we're excited to find a way to solve it.
That's exciting. Do your portfolio companies tend to be companies founded by doctors and clinicians just because of the AMA relationship?
No is the short answer. We get a lot of founders who are, I would say they're scientific or technical in nature, but they certainly are not only physicians. I think the archetype of the type of founder we're looking for is somebody who's got this kind of like high conviction about a solution and understand the problem really well. So we've got everything from founders who come from the communities they serve, and we can talk about that in a little bit, through to people who've spent years studying the subject matter, who are not physicians, they're just researchers. Well, not just, they're amazing researchers, and they're able to they're bringing really innovative solutions to market.
All right. And how about any companies that are in the portfolio that might be name recognizable to our audience? Any ones you can kind of shout out and say, hey, like they're part of our program and here's what we did with them?
Yeah, totally. So the first is probably Zing Health. They're an awesome managed Medicare health plan based out of the Chicago area. Founded by Dr. Eric Whitaker. He's a wonderful serial entrepreneur who came to us with this idea of building an MA plan for underserved communities in the Midwest, chiefly African American and Latinx, but that's actually expanded to a number of other communities since their founding. And we're excited about what they're doing and the community they're serving. Part of our mission is to expand the access to healthcare, right? And so this was a wonderful opportunity to work with Eric, but more importantly, it serves both an IRR purpose and a mission purpose, which is about transforming healthcare. And for those communities who just don't have the simplicity of access, Eric had a really compelling story and reason to build this business, and we're happy to kind of partner with him to build that.
Great.
Another one, you mentioned RecoverX. I'm on the board of them. They're actually rebranded to be Ividium, but they're equally a fascinating company. They're doing AI. They're an AI platform for referenced AI is kind of their tagline. I think the goal that they have is how do we instill and embrace the idea that LLMs can work in healthcare, but you have to have this kind of knowledge capability and a back end that really makes sense for scaling that referenceability. Doctors don't have a lot of time for wrong answers, and so that referenceability, which by the way is in the recent publication from the White House and other institutions globally, this is going to become more and more important. We're excited to be working with Carl Bate, the CEO over there.
Love that. Recently, CB Insights listed Health2047. They ranked them number 2 in the list of top corporate innovation companies in healthcare. Why do you think that is? Why do you think you were chosen so high?
It's quite an accolade. First of all, we're mission driven. I think that makes life. It makes making decisions a lot easier. We want to make money, but we're first and foremost after businesses that will transform healthcare with our thesis on board. And our thesis is really around chronic disease management, data liquidity, and you can edit this, chronic disease management, data liquidity, and physician productivity. There we go. And I think our venture model works uniquely in the sense that we are working in venture. We do partner with these companies, but we also have a seed fund that can work and back those companies. So you're not joining us just for the venture studio journey, but you're also getting what we think is world-class advice and access to partners. But probably more importantly, there's a check that goes alongside that. And we love our venture community that we engage with for onward funding, and that's been a wonderful way to kind of partner with those companies from pre-seed to seed, and then we're now doing a number of A-round raises.
You've been involved in product formation and refinement through go-to-market strategy and execution. What challenges do you often encounter?
Ooh, good question. So I think from a founder's point of view, the first port of call is understanding that there are really 4 groups that you have to serve within healthcare. You're always looking for that patient and physician relationship and how you're trying to solve that. Most digital health companies are going to play in that space. But there's a secondary set of people or organizations that are critical in any of those businesses. which is the provider system themselves. So oftentimes I think a misconception is that the physician is going to pay for this. It's very rarely is the physician actually paying for it. It's the provider system themselves. And then the provider system, where are they getting their money from? From the payer. And so you end up with this kind of like 4 boxes on a diagram that you end up having to kind of fill out. How are all these parties benefiting from my product, solution, service? And that is, I think, one of the biggest hurdles for many founders, but actually where I spend most of my time is kind of deconstructing that. And then you can kind of go into a lot of different things around, on the patient side, okay, what's the usability question? On the physician side, do I need to have a UI in the first place? Is this solution going to embed into their workflow, et cetera? And then there's the economic incentives that you need to kind of think through for payers, and then provider systems are looking at an efficiency and productivity, value add from whatever that is. So that's where we spend most of our time, frankly. We do a lot of other things around product engineering, roadmaps, and things like that. But I think the unique thing is in the four fields there.
Yeah, you got to have your core competency, and it sounds like you have a really nice investment thesis. How do you guide founders and entrepreneurs through their go-to-market execution?
So the first one is segmentation, right? And so, going back to the 4 boxes, but more importantly, not all doctors, frankly, are customers, but equally not all, you could be selling to nursing staff professionals or administrators. Not all of them are made equal. And so being really kind of, I think, mercurial about who those segments are, because if you go into a market thinking that, then you're going to struggle with the ROI for that audience. And by the way, it can be very minor tweaks on a product, but if you're not kind of clear on what those things are, then that can often be a struggle. So, we often end up with this kind of, okay, let's do the TAM and all the, wonderful economic opportunities, but then you're going to go and look at the product and you come back to that TAM and then segment that TAM more thoughtfully. And that's where I think the majority of our commercial strategy, time gets spent. And then the other end of that, which is, wonderful, we spoke earlier about the academic medical centers and research organizations. Well, we get to go speak to them and say, hey, this is a company or this is a team we're interested in or excited about. What do you think about this? What's your buying process look like, et cetera? And then sometimes that can result in, the best case is that it results in a customer relationship. More often than not, it ends up in a very thoughtful feedback loop. And as an adamant practitioner of design thinking, that is a very valuable feedback loop to get into any nascent team.
What would you say are the 4 major hurdles a healthcare startup faces, and how do they overcome each?
Great question. So first of all, it's having a great team. If you don't have a great team, what you're going to find is that you can't achieve any of the other 4 or 3 things on this list.
I would tend to agree in my line of business. So I'm fully supporting number 1.
And honestly, a great team does not mean you need to have everybody with a A-list university degree. I think that's a legacy. I don't think that remains anymore. But a lot of investors want to see that there's a great chemistry in the team, but also a good mix of roles and responsibilities, right? And so that's what we're looking for, particularly when we first meet founders. The second, which is a bit cliche, I think everybody's going to say this, but is product market fit. And we've already talked a lot about the kind of customer focus and things like that, but it's really kind of honing that story. And what we're hoping is that somebody really knows the space so well that it's inconceivable that anybody other than them could be building this product to solve that problem. The next is this customer or this commercial strategy that what we found increasingly in healthcare is that it's hard, right? And we haven't even touched on like CPT codes and all the payment models and things like that, but it's really how do you build that commercial organization. And so I think that's a struggle that anybody's going to have, and that's one of the reasons why Health2047 believes in what we're doing and why we're happy to help founders on that journey. And then the last is what the scientific or educational basis for your product is. More often than not, the question is going to come up: how do we know this has an impact on the community you're trying to address? And so we are we are, I don't know if we're unique, but we certainly are high conviction on there has to be scientific basis for how your product or service is going to help patients or physicians themselves. But that doesn't mean that you have to go run your own clinical trial. There are tons of papers on PubMed. Maybe you yourself are a researcher that has got some unique perspective. Those are things that we'd love to hear, and we work with founders to expand that capability set where it's necessary.
I asked a lot about challenges as well as stumbling blocks that companies may have. What are some of the best successes you've been a part of and most proud of?
So the biggest one that I'm really excited about is Zing. We backed the company and it was launched at the very start of COVID. Our strict memories of feeling awful working in a room with the team right at the outset of COVID. But it was really the struggle of here we've got an amazing group of people around the table, and we've got to somehow get our message out on a shoestring of a budget for what's called the annual enrollment cycle. So anybody here in the US, that from mid-October to early December, you're going to get hounded by MA advertising. But we didn't have a budget to hound anybody with advertising. And so between Eric Whitaker and a number of other team members, we came up with a lot of, I would say, not guerrilla, but certainly more appropriate strategies for engaging communities we were focused on. Not only did it open my eyes up to the whole AEP revenue cycle and how broker dealers all work and things like this, but how small activities in marketing for targeted communities, going back to segmentation, we were able to move the needle massively. And I think we hit some pretty good numbers for our first year, having had no MA plan historically. And the team's kind of moved on and gotten people on board. But this is one of those instances where Health2047 as a co-founder of the organization, we felt it was the right thing to do to step in and say, hey Eric, can we help you with your digital marketing strategy? Can we help execute that? And I think more often than not, we find ourselves asking that same question to whether that's SiteBridge or Phenomics Health or Avidium, et cetera. Here's our recommendation on strategy, or here's where we think some strategy elements might be. How can we help execute that? And that's a unique thing I think within our community, particularly for board members.
Yeah, that's fantastic that you're able to really roll up the sleeves and do what it takes to help your early stage companies. There are a lot of companies right now that are early stage that are struggling to find funding at the moment. I think it's really challenging market conditions. What are you doing to coach your earlier stage investments that are, potentially going through an early stage round?
So, the first thing is going to be thinking about the kind of those 4 hurdles we talked about earlier on the startups, right? So, you solve for those. Those are things that are within your control as the founder. The recent CBI, CB Insights data would suggest that we're back to about 2016 funding numbers in digital health. But we've kind of balancing this like mega rounds versus, for later stage companies, et cetera. Net is that fewer companies are getting more money. That said, for early stage companies, the kind of the opportunities that exist out there are making sure you can be super clear about how you're solving a problem. I think a lot of investors are looking for some commitment in capital from a revenue point of view. I don't know if that looks entirely like ARR right now, because everybody's struggling. Like hospital systems have no money, and investors are looking for shrewd investments. But I think that the opportunity for any founder out there right now has to be that high conviction about what you're doing, and the blood, sweat, and equity that you've probably already put into the business. And look, at the end of the day, that's why businesses like ours, and there are a few others that are in this space, the venture studios, that are out there trying to listen for people. So, if any of your listeners have an idea or they're working on something, please reach out to us. We are more than happy to talk to you, no matter what stage of your idea that is.
What are the spaces you and your firm are most interested in getting into or continuing to invest into?
So we are I would say we're bullish on the application of AI. I think most investors will probably say something to that tune. We're looking for solutions to problems that AI can solve. Versus, I think there are a lot of companies out there that are great wrappers of AI solutions, and they'll find their place. But we're definitely looking for solutions that may involve AI. We're actually really fascinated by women's health. It's an area that is underinvested, and frankly, there are a number of female-focused VCs out there that we're excited to partner with. But probably more importantly, there are a lot of founders out there that probably aren't getting the time that should and that they should. And women's health, they're 50% of the population, and yet I think unfortunately, we can speak to most women who will tell you some negative story about their interaction with the health system. So we're super excited about that space. And then we continue to be interested in tech-enabled services. I don't know if anybody's cracked the code yet, but we are interested in tech-enabled services. Physician extenders are critical. We don't have the density of physicians at a macroeconomic scale to keep up with the morbidity and mortality of the country. And so these tech-enabled service lines can be thoughtful ways of extending within those populations, within those disease states. But I think the struggle I have right now is what's the business model that scales, at massive scale, right? And so that's where we continue to have a thesis, and we're looking for opportunities that can educate us better on how that can be done at scale.
All right. Well, you heard it here first. If you're a founder and you're in one of those spaces, you got to reach out to Warren and team. They're going to take care of you. When developing a product, how do you decide, whether it should be consumer focused, enterprise focused, like where you find and build a product and know like where to sell it to?
So in healthcare, it's unique in the sense that very rarely is it, you're just a B2C solution. Maybe you are a B2C solution because you've got a sleep coaching app, right? And you have no desire to interact with the healthcare system. But the moment you want to bring in a doctor into that fold, everything is run through, the traditional CPT code process, right? So billing is done with fee-for-service and value-based medicine. And so you have to be thinking about how that interacts with those physicians. It may be that the right angle is that you are a SaaS company that charges the physician, and so that's that B2B solution. It may be that the person benefiting from that is the patient themselves. And all along that journey, you're having to say, okay, how's the doctor going to make money? How's the health system going to make money? So in healthcare, I think very, very, very few opportunities are pure play B2C, to patient. There are companies out there that have cracked that, right? Hims and Hers is a great example. But most companies that are doing, I think, things within workflow will be, and that's frankly where we spend most of our time, is thinking about businesses and solutions that are in the workflow of healthcare. That's where we would expect that most businesses are going to be B2B companies that may have a customer or a patient-facing component.
And even going a little bit deeper, how can you help guide a company to tell them, hey, I think your best route is to sell to health plans. Your best route is selling to self-insured employers. Your best route is selling directly to the health systems. How do you help them determine that piece?
Fundamentally, it's who benefits the most. There's no one size fits all, and that's where we spend a lot of time with our startups to try to think through that. But ultimately, I think the answer will always be that the best businesses will figure out how to speak to every one of those constituents.
Great. What are the traits you're looking for in founders? A lot of founders I've met have been ultra successful. None two are very alike or similar, but I think they all have some traits, that are in common. So kind of walk us through what you look for. What do you think is most important?
Yeah. So we've talked a lot about conviction. So you have to love what you're doing, right? You're wedded to this as the CEO until either you reach for the stars or you finish, but you're wedded to this as a CEO. The other one we find is often a hard one to evaluate up front, but one that we keep coming back to is humility. And humility can come in a lot of different forms. Lifelong learners, coachable. It's really about, can you listen to impact or to feedback from others and process that. And you may come to a different conclusion, but at least being able to kind of process that. The last one that I absolutely love is what we call effectuation. And this is the ability to effect onto others the passion for this problem you have, right? More often than not, a CEO of a startup company in our pre-seed, seed stage, you're lucky if you got any money to pay employees, particularly market rate. But you got to instill this opportunity that this is a love we have for everything we're doing in healthcare and how we're going to transform the behavior, and we may not even have a line of code written. And that's actually a really hard one to kind of find, but effectuation is one of those amazing things that some of our founders, we're excited because all of our founders I think have cracked that nut.
Yeah, those are all key things I've found in common with people that just do tremendously well. So I ask everyone who comes on this podcast not only about what they're doing in the space, but how they're living it, breathing it, sleeping it, like how they practice what they preach. So I guess in your personal life, walk me through how you personally participate in wellness, exercise, how you reduce stress.
So first of all, walks. Just outdoors is just an amazing place to center yourself. To remind ourselves how little we are, but also how much a bit of fresh air, and no matter what the season is, to take that as a moment to breathe out, quite physically and metaphorically. And I go on walks.
I hope you take the dog on the walks.
The dog, yep. So the dog and I have our daily top and tail walks. But equally, I love going for a walk with my wife, my son. Oftentimes with some of my colleagues, we'll either do a lap of our campus or go on a hike. Up in the hills is very cliche here in Silicon Valley. But it really is that opportunity to kind of be thoughtful. I think the other one is exercise, right? Some people use yoga and other meditative techniques. I need to exercise, and so my passion is for cycling, and so I'll get out and again that outdoor time. Although with a 2-year-old in the house, I spend less time outdoors and more time on my Peloton these days. I think I've got a colleague in the same challenges.
Yeah, no, I've got a 2-year-old, and for sure, not as much free time as we used to have.
Negative.
But wouldn't trade it for the world. Mila is my entire pride and joy. So walk me through just any home recipes you make, that are healthy, that keep you and your family, healthy and, very ready to take on the, day and the week.
So I think the thing so first of all, everything I do is a majority is Mediterranean cooking. My family, we grew up with it, and so I absolutely love it. The thing that we do, I love cooking, particularly in the summer and through to autumn here, is zucchini lemon pasta. The amazing thing here in Northern California is you can grow a lot of things yourself, and so we can grow the majority of the vegetables and fruits that go into it, and it's just a wonderful, simple dish. It's zucchini, garlic, a little bit of lemon, some basil, and pasta. Whack it all together, and it's a great recipe on Bon Appetit.
Oh, I'm gonna have to check it out. I'm assuming olive oil is in
there
as well.
Oh yeah, plenty of olive oil, maybe a little bit of cream. You can vary that depending on your appetite.
I like it. Very good. Well, again, Warren, thank you so much for joining us on the Digital Health Heavyweights podcast. Really looking forward to seeing what you and your portfolio companies are able to accomplish at 2047. And definitely we'll have to have you back at some point.
Look forward to it, and stay in touch, Norm. Really appreciate it.
Thank you, Warren. Appreciate it. You were great.
Thank you.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.